Hi, everyone. I'm Diane Smallage. I am the interim dean for the Forsyth School of Dental Hygiene here in Boston. We also have a campus in Worcester, and I oversee both programs. And it's my privilege to welcome all of you to the presentation about our program. Very proud of our program. It is the longest continuously running dental hygiene program in the U.S. So we opened in 1916. Yes, we are more than 100 years old. And you may hear that there was a program that opened before ours, which is Phones down in Connecticut. And they did open before us, but they had some interruptions with the war. So we get to claim that we're the longest continuously running dental hygiene program in the U.S. And I think that says something about the value of our program and the strength of our program, that we've been here this long and continue to graduate successful clinicians. So what do dental hygienists do? I find students don't always know, or potential students aren't always aware of what dental hygienists do. I know our patients aren't even always aware of what we do. So some of the things that are in our scope of practice, I want to share with you right now to help you have a better understanding of what it is we do. One of the most important tasks is to perform oral health assessments. And those are done as a means to best determine what our patients' oral health needs are. So for example, we may assess the oral cavity to see if there's any decay. We might assess to see if there's any gum disease, or what we call periodontal disease. And we take the findings from all the assessments we do in the oral cavity to determine the dental hygiene diagnosis and also the treatment that we're going to provide. Those oral health assessments are also invaluable to the dentist and any of the specialists we may refer our patients to. Without that information about what's going on in someone's mouth, we can't do the next thing that we are very proud to do for our patients, and that is to educate them. So educating patients is very important, because unless our patients understand what's going on in their mouth, what we would do and the care we would provide would almost be in vain. In order for us to successfully guide our patients, they have to take ownership, and they need to be empowered to know that they have control over their oral health more than they may realize. So we can guide patients with that information once we've performed those oral health assessments, and we can tell them what's going on in their mouth. Counseling patients is something else we do, particularly in the area of nutrition and certainly on how to take care of their mouths. So good nutrition, and nutrition is an important class and coursework that you complete here. Helping patients understand what's contributed to good and bad oral health is very important. For example, if someone ingests a lot of sugars or simple carbohydrates, we need to help them identify what foods have those simple carbohydrates and might be contributing to their cavities. We know that a good sound diet also helps strengthen people's gums and bone and all the supporting structures for their teeth. And so that's also something that we need to guide them with. Of course, we need to show them how to brush their teeth, how to use floss, and all the other products that might be available to them that will help support their good oral health. We also expose, process, and interpret dental x-rays. Those x-rays help us in our dental hygiene diagnosis. It helps us identify if there's cavities, or what we call dental caries. It helps us find out if the supporting structures are solid and that there's no disease process going on, and that's gum disease, which also involves the bone and the ligaments in your mouth. In addition to taking x-rays, which the dentists and other specialists will also use, we apply oral health preventive agents to our patients' dentitions, particularly children with sealants, and both older adults and children and people of all ages should get fluoride if they are at risk for dental caries. We apply professionally prescription strength fluoride for our patients. So identifying those things our patients need is a very important part of that assessment process, and it makes all the difference in our patient outcomes if they're getting these preventive agents. We also perform meticulous subgingival below the gum line scaling. Not something our patients are always happy to have us do, but it's very important for us to be able to assess the tissues below the gum line, remove any soft deposits and hard deposits, and help prevent periodontal disease or gum disease from progressing in our patients. And part of the reason we administer local anesthesia, also known as Novocaine, is so that we can sometimes numb up a patient, anesthetize them in the areas where we're going to be working where it might have some discomfort. Now, people are often surprised to find out that dental hygienists can administer Novocaine. It's not really Novocaine. That's an old term. It's lidocaine or carbocaine, and there's other kinds of anesthesia that we use. In the state of Massachusetts, not all parts of the country allow hygienists to do this, but in the Northeast, hygienists do administer local anesthesia, and we're very good at it. And it really helps our patients have a higher level of comfort during our treatment that we provide. We also work outside the clinical and private practice settings. We work in communities, we work in public health settings. I'll be talking a little bit more about that in a few moments when we talk about alternative providers. So we are very important to the community. Our students go out into the community and they go to senior centers. And we have a thing called Give Kids a Smile Day, where students and children come into our clinic and we provide free care so that we can assess, educate, and counsel them, which they wouldn't get otherwise because they don't have the means to receive dental care. So we have a number of different programs within the Forsyth School of Dental Hygiene, and the one that is the most populated is the Accelerated Bachelor of Science in Dental Hygiene program. This is where students earn a bachelor's degree in dental hygiene. Not all programs are bachelor degree programs, and I tell every young person that I encounter who's looking at dental hygiene, go to a Bachelor of Science program because it's going to provide more opportunities for you when you graduate. What's unique about the program here at MCPHS in Boston is that it's a 3-year program, so it's accelerated. Our students earn a bachelor's degree in 3 rather than 4 years. They work through the summer, and that's why they can complete in 3 years. It is an innovative curriculum for this reason, and the students find that continuing through the summer keeps the momentum going. They don't disappear for several months and come back and try to get back in the saddle again, so to speak. So we do offer many opportunities outside. I'm going to talk about that a little later as well. And again, we pride ourselves on the service to the community. We also have a pre-dental program, and this program, when students arrive, is one where they take 2 full years of general education courses, and those general ed courses are the ones that you need to get into dental school. So the regular dental hygiene program doesn't include organic chemistry or physics or some of the courses that you need to take in order to apply to dental school. So the pre-dental program was set up so that students complete 2 years of general education courses, complete a degree in dental hygiene, and then they can apply to dental school. I have to tell you that students who have come through our program and gone on to dental school have been highly successful in dental school. We're really proud of our graduates. In fact, we have 3 of our former students who went on to dental school that are now back in our clinic teaching students. And we're very proud to have them there. And they're invaluable to us because they understand what it's like to go through dental hygiene school. They've gone to dental school through the preventive lens of dental hygiene. And I think they're stronger dentists than anybody else out there. So yes, we have a pre-dental program, and it does prepare you to move immediately on to dental school. We also offer opportunities for students, whether you are pre-dental or you finish with a dental hygiene degree as a result of being in the accelerated program. Most of those folks go on to private dental practice. We found even the students that go on to dental school, they enjoy working in private practice even 1 day a week as a dental hygienist. Not only do they earn a little money, but they end up having this experience that helps them when they get into the dental school. We had one student that told me a story that they had been they were in dental school and they had started their clinical work, and they were very comfortable, very much at ease with patients. Some of the things they were doing, they were breezing through it, and that they had not told their classmates they were a dental hygienist. And so finally they had to admit they were a dental hygienist, so the students understood why they were doing so well in clinic. And that's one of the ways the pre-dental program well prepares our students when they move on to dental school. But anyone that graduates from our program, regardless of pre-dental or the accelerated program, most go into private dental practice. We do have some who go on into education. I mentioned those dentists who have come back. We also have our I was on the clinic floor this morning and was greeted by two of our former students who have now come back. They teach in our clinic, and they're invaluable to us because they understand how it feels to walk that walk, because they haven't been out of school that long, but yet they've been in private practice. So they bring something to our students that nobody else can. And research, yes, believe it or not, dental hygienists are also researchers. Why do you have to know research? Why do you have to know how to look up studies? Well, that's because you're going to have patients ask you on a daily basis about oral health products. How do you know if you could recommend these products to patients or not? Well, you need to know how to look up their value by doing research. And there's a scientific method to doing that, so you can ensure you're giving patients good guidance. We do have students who also love going on into research. We have students that move on to our master's program and love to investigate dental hygiene science and those products. They end up being researchers as a result of being in our program. We've had students move on to corporate work. For example, Colgate, Procter & Gamble, Dentsply. There's a bunch of companies that have hired our students. They go out, maybe they're in sales, perhaps they're educators. Some of them go around to schools and educate about products. So there's always that opportunity with a bachelor's degree. You can't do this if you only have an associate's degree, but a bachelor's degree allows you to go out into these kinds of positions. Then there's alternative practice. I mentioned this a few minutes ago. And these are alternative providers, and they vary from state to state. So, for example, in Massachusetts, you can go on and get a certificate and become a public health dental hygienist, a PhDH. What does this allow you to do? It allows you to go out into non-private practice settings and provide care to underserved patients. For example, we had two of our graduate students left our master's program that bought mobile equipment, set up a business, and they go out into communities and they provide care to patients that are underserved. They're reimbursed by the state. They also do some private practice work, and they're very passionate about public health and ensuring that all people in our state receive the oral health care that they deserve. Now in Maine, we have an independent practice dental hygienist. I actually live in Maine. I have a friend who is an IPDH. She has her own practice. Scope of practice is limited. There's a few things you can't do in those settings because you need a dentist supervision. But what's been great about these alternative providers is that they've been able to provide care to patients who otherwise would not receive care. So you're going to learn in a course called Community Oral Health all about public health, the needs of underserved people, and a lot of our students become very passionate about being these kinds of providers as a result of being in that program. What's it take to be a dentist and a dental hygienist? Well, for a dental hygienist, licensure and dentists do a very similar path. You have to take two major exams. You have to take a state exam as well, and that's individualized to each state, where you have to understand the laws of your scope of practice within the state. But we have two major exams that I want to discuss, and one is a written national board exam. Everybody in the United States has to take this exam in order to secure a license, and it's the same for everyone. The regional board exams are just that. They change from region to region, but the most common one, the one that is used in all of New England, is called, what used to be called the NERB. They just changed their name. It's now the CDCA exam. This is the live patient exam. Well, this year we had a lot of challenges with the live patient exam because of the pandemic. And the Board of Dental Examiners here in Boston, they actually are in Boston and Massachusetts, BORED, decided that a mannequin exam could be used to assess students' clinical skills. So our students were able to take an exam in our clinic on a mannequin, fake teeth, for lack of a better term, and they were able to show that they could remove all of the deposits and successfully treat that patient with the removal of what we call tartar or calculus. So I have to tell you, it was very successful. We had a 94% pass rate on that mannequin exam this spring. And also from last December when our students took the exam at that time also. So we have a very high success rate on the NERB, what's now the CDCA. The jury is out. We don't know about our national board exam for dental hygiene yet. And that's because the testing center is closed. So we have more than half of our students that still have not even taken the national board exam. Their licensure has been delayed slightly. But I can tell you that over the last 10 years, we've had a success rate on the national written board exam in the 90s. It's been as high as 96%. It's never gone below 90%. I think actually 92% was our lowest pass rate. So we do have a very high success rate on the national board exam. Can't tell you what it is this year because we're waiting to find out. So what kind of life is it for a dental hygienist if you look through the lens of the Bureau of Labor? Well, if you're a dentist, you do pretty well. You can see the median salary and how U.S. News and World Report has ranked it as the #2 of 100 best jobs. I think dental hygiene should be up just as high. They're ranked number 24, but dental hygienists do very well. And I have to tell you, we had a lot of concerns about our students being able to find a job when they graduated because of the pandemic. Well, I get at least 4 or 5 requests for me to post jobs to tell our students about jobs that are available. It turns out that the pandemic resulted in a lot of experienced hygienists wanting to reduce hours or even retire from the profession. I've never seen so much interest in our students who are graduating than I did have this year. So the pandemic has actually been not negatively impacting our students. It's been a silver lining. It's created jobs for our new graduates. So if you're wondering about the job market, it's very strong, and hygienists do very well. So why MCPHS? I love this question. Why should you come here to Boston? Well, I want to start by sharing with you what has happened as a result of the pandemic in regard to our students and how being in this area has helped them. We had to close our clinics in March, as did all dental hygiene programs, and we weren't able to open them until late in the summer. We had to develop new protocols. We had to have students wear additional PPE, which was not easy to procure and keep a supply. It took us several months to get our clinic to a point where we knew our students, our patients, and our faculty were going to be safe while they were here. So when we reopened, we also realized and understood we had to be at half capacity. So our students could only spend half the time in the clinic each week that they had prior to COVID-19. What did we do? Well, in the midst of developing all these protocols, we also reached out to the community and we developed some external sites where our students could go and have experiences and complete their work. This ended up being a silver lining in the pandemic for us, because the experiences our students have had in these external sites have been very positive. The feedback we've gotten from those who've attended have said they feel more well prepared for practice. And this was probably because we were able to send one instructor for every 2 students out into a private practice setting. So there they are treating patients just as they will in private practice, but with the instructor to guide them. I had one student that said when they left in March, they didn't know how they would be ready to go out into private practice. And just last week, they shared with me that they are ready. They felt prepared, and it was because of these external sites. External sites aren't always easy for programs to find, but because we are in the Boston area, we were able to develop external sites all the way out to Springfield. We have one in Lynn. We have some right here in Boston. In addition, we are working with Boston Children's Hospital to set up a program and experiences for our students to treat young children and adolescents who have oral health needs, but are medically complex and need to have that care provided in these settings. One of our faculty members who teaches here also works at Boston Children's Hospital. So it's those kinds of connections that our program can offer that not all programs are able to offer. So we're delighted to be in the Longwood medical area and to be able to provide those experiences for our students. Collaborative practice. This is the last thing I will touch on with all of you, but I want to share with you that interprofessional education is becoming very important. In fact, we're required to offer those experiences to our students in dental hygiene programs. Collaborative practice means that you're going to interact with other disciplines. And I think the best way to explain what these experiences are is by sharing with you one of the experiences we developed with the PA students, our physician's assistant students here at MCPHS. So we invited them into our clinic, and the intent was for them to work with our students on health histories and for our students to talk about oral exams and what's going on in the intraoral cavity. So the PA students, because they're so focused on general health, they were able to sit with our students and talk to them about what was in the health history and good follow-up questions. Ask them, why are you asking your patients these questions? And it helped them relate that to their own practice as oral health specialists. Our students, in turn, taught the PA students about structures inside the mouth and what they were seeing. And a lot of the PA students thought that what they were looking at wasn't a normal structure, and when it was, and our students were able to guide them that way. When this experience was over, we actually surveyed all the students, and the PA students told us that they really felt differently, not only about what they knew about what dental hygienists did, but when they were in their own practice settings, if they had a question about something in the intraoral cavity, they were going to call their dental hygienist because they realized they had that knowledge base. In turn, our dental hygiene students told us that the PA students had taught them how to be more insightful when reviewing a health history with a patient. It increased their understanding of the questions they were asking, and it was going to help them in their own practice. This is why we've started interprofessional education across the country, and this is why it's a very important initiative here at MCPHS. I serve on a working group that is developing these programs, and I'm very excited about IPE and what this is going to mean for our students that are coming into the program. I didn't have this. We all practiced in silos, and now we're reaching across disciplines. And guess what? Guess who's benefiting from that most? Our patients. So these are some of the things that I wanted to share to help you understand how innovative our program is, what a strong program it is. And by the way, if you'd like to see our program up close, you can come in and be a patient. You can you can Google us, you can find our phone number here in the Boston area, and you can set up an appointment and you can actually sit as a patient for one of our students. Talk about having a front row seat. So I appreciate your time, and I hope I've answered questions you might have had about our program, but please don't hesitate to contact me. If you have questions, I'm always available to take a phone call and answer an email. So thank you for your time, and I wish you well in your endeavors.